Here's a quick tip that I learned from David Carr on expediting your trial of void. Typically what we will do is pull the Foley and then wait for the patient to pee. The problem is that that bladder is empty and it's going to take time for it to fill, which means the patient's going to be lingering in your department for hours. Often we will give the patient some fluids to drink, but that doesn't really speed things up all that much. And if we're impatient, we might give them an IV fluid bolus. But that gives the patient an unnecessary fluid load, which can cause harm to the patient, like volume overload, which can be a particular risk if the patient has a history of CHF. So here is the trick. Before pulling the Foley, instill about 250 to 300 cc's of normal saline into the bladder. Now when you pull that Foley, you know the bladder is full and the patient should want to go to the bathroom pretty soon after that Foley comes out. If they don't go in about 20 to 30 minutes, trial of void has failed. Replace the Foley and get the patient on their way. Thanks again to David Carr for that great tip on speeding up your trial of void.